All right, let's get this show on the road. So, hello everyone. My name is Eustra, and I'm a research assistant with Peach Health Ontario. On behalf of Peach and the Canadian Coalition for Green Healthcare, I'm so excited to welcome you to today's webinar titled Canadian Healthcare Forests: How to Bring Nature to Your Healthcare Facility. So before we start today, I want to take some time to acknowledge with respect the Indigenous peoples and communities whose relationships with the land continue to this day and on whose traditional territories our work takes place. So we acknowledge a debt to those here before us and recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have with this land. All right, so throughout this webinar, please use the chat function for any technical issues you might be experiencing, and please use the question and answer function for any questions you have regarding the presentation. Our panelists will answer questions at the end of our webinar today. And just as a disclaimer, we will also be recording this webinar, which will be sent to all registrants and be available on our website and our YouTube channel shortly after. All right, so in a short couple minutes, you'll be hearing from our panelists, and I'm just going to take a quick second to introduce them as well too. So we are joined today by Amelia Fletcher, who's an occupational therapist passionate about integrating green spaces into green healthcare. And her presentation today will share mental health benefits of green spaces in healthcare settings. We're also joined by Michel, who leads the Forget for a Moment Foundation, which focuses on creating restorative garden spaces in healthcare facilities. And he'll be showcasing innovative garden designs and nature-based programming. And then we're also here today with Daryl, who focuses on embedding planetary health principles into healthcare systems, combining sustainability with social justice. And Daryl will explore strategies for incorporating nature-based solutions into healthcare. So with that, I'm going to give the floor to Amelia, who's going to start us off.
All right, I'm just going to share my screen here. There, can you guys see that? All right, so I'm here today to talk about the Day Hospital Wellness Garden, a space for growth. I'm Amelia. I'm an occupational therapist with experience in mental health, health promotion, and workplace wellness, working in Halifax, Nova Scotia, or Jabuktuk, which is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. I'm a strong advocate for creating access to green spaces for patient outcomes, provider well-being, and planetary health. As an OT, I have a deep understanding of how environmental factors influence health and quality of life. Through nature-based interventions, I aim to foster a sense of responsibility to take care of what I call the capital E environment, to promote health for future generations and our planet. I'm really interested in the effects of climate change on health and well-being and the impact that this will have on our healthcare system in the future. The Wellness Garden is a project I oversaw while working as a clinical occupational therapist in acute care psychiatry here in Halifax. Prior to my role at the Day Hospital, I worked in both inpatient and outpatient mental health, where I also co-facilitated gardening programs with patients at the local community garden. Recently, I've transitioned into a non-clinical role as a workplace health promotion coordinator with Nova Scotia Health, contributing to policy, programming, and resources to support employee health and well-being, where I hope to continue to advocate for connecting people with nature and facilitating discussions on sustainable practices. So these are just a few snapshots of our bounty from the Wellness Garden, and also a few snaps from the Wellness Garden itself. The Wellness Garden is located on a public patio between the Abby J. Lane Memorial Building and the Veterans Memorial Building at the QE2 Health Sciences Center. So if you ever find yourself in the neighborhood, you can pop by and check it out for yourself. Oh, I think my screen is frozen. Am I frozen? Oh,
You're not frozen, but...
heck. There, can you see it? There we go. So I just did a quick who, what, when, where, why. So maybe we could start with the why. So participating in healthcare in alternative and deinstitutionalized spaces helps support dignity and reduce power dynamics, and can be a more trauma-informed way to deliver healthcare. And this can, in turn, improve patient outcomes and also employee outcomes, which we'll talk about on the next slides. The Wellness Garden allows us to build capacity in accessing healthy food choices, physical activity, and reducing the impacts of food insecurity, and planning how to transition these skills into community. The Day Hospital Wellness Garden create an opportunity to access the evidence-based benefits of nature on psychological, cognitive, and physical health in an urban setting. Some of these benefits include self-esteem, mood, mental fatigue, attention, memory, problem solving, social connection, cortisol reduction, and decreased length of recovery and pain management. The garden and other regularly accessed green spaces in our city allowed for space for patients to practice coping skills in community, build social skills, and develop new hobbies and lifestyle changes. I don't use Strava. For some reason, every time I try to transition slides on my end, it looks frozen, and I apologize if that's happening.
It is
On
still on the Y slide, but I think maybe since you have it on two screens, maybe you have to switch it on the other screen.
No, like everything's frozen on my end.
Oh,
I'm sorry, everyone. Just one sec.
I can get the slides open on my end as well too.
There, can we see that?
Yeah.
How? Okay, so how did we do the day hospital wellness garden? So the wellness garden was definitely a teamwork effort. All staff and clients at the day hospital played a role in its planning, funding, planting, and harvesting. And near the last couple of weeks of our garden season this year, our team had a discussion on how to partner with the other specialty services within our mental health and addictions program and our colleagues in inpatient psychiatry. The Day Hospital Wellness Garden was made possible by generous funding from the Nova Scotia Mental Health Foundation. Our team applies for funding through the Nova Scotia Mental Health Foundation every year, and we've reapplied for funding this year to continue with our current vegetables, flowers, and also increase our seeding options, and to hopefully start our native pollinator garden. After inviting staff from the foundation to see our garden, they also donated some propagations to support an indoor plant library for us at the Day Hospital. We also partnered with Lake City Works to build accessible raised beds from recycled materials. Lake City Works is an alternative vocational program here in Dartmouth, Nova Scotia that supports adults living with severe and persistent mental illness. We worked with clients in the early spring to identify flowers and vegetables they would like to see grown in the garden beds and pots, and we incorporated daily gardening maintenance and harvesting into pre-existing programs and groups. So we often ran a mindfulness group, a physical activity group, art therapy, social groups, and cooking groups, and we were able to use the garden in all of these groups. We initiated an indoor gardening group late this fall, and clients are now able to plant a seedling from our plant library to care for at the end of their admission and are provided with prompts on nature-based coping and mindfulness strategies. So from a patient and family outcome perspective, the garden and our indoor gardening group facilitate discussions about accessing community gardens and green spaces, so parks, beaches, and community gardens, as a means to engage with meaningful activity. And it also created an opportunity for us to discuss programs like Lake City Works and Shelter Nova Scotia. So we used the produce that we harvest on a regular basis so that patients could take it home to share and eat with their families. What was remaining was also available for staff. And we used the produce regularly in a cooking group where clients learned the skills to prepare healthy meals. Each month, clients would prepare a meal and the produce from our garden to donate to Shelter Nova Scotia. Our garden also facilitated opportunities to build and practice sensory-based coping through mindfulness prompts and aromatherapy. And patients and family provided some feedback while we were out working in the garden. And one person had said that since her husband had been admitted, nothing had felt normal. And being able to have a space to drink coffee on the patio and listen to the wind chimes provided a sense of normalcy in their routine during that time. Another client had shared with us that they found the garden and being around nature so peaceful that they bought some houseplants to take care of on their own at home. From an employee wellness perspective, whoops, oh my gosh, now things are jumping around too easy, not frozen. There we go. From an employee wellness perspective, the benefits of green spaces to employee health and well-being are well documented, and they include improved job satisfaction, improvement in memory, attention, problem solving, and creativity, support with mental fatigue, improved mood and anxiety management, stress reduction. And word traveled quickly about our little garden. So we noticed people from all buildings and programs within the QE2 Health Science Center coming to enjoy their breaks and their lunch. You could often see staff on their breaks reading, sunbathing, or engaging with the mindfulness prompts that we had posted around the garden. And it was also nice to observe providers from these programs and other buildings engaging with their patients in this space. One resident had approached me while we were working in the garden and said that it was so nice to have a space to enjoy lunch without always having to be cooped up in the hospital. And they wished that there was more spaces like this for them to access. And then finally, from a planetary health and sustainability outcome, the Wellness Garden allowed us to foster discussions on how to replicate spaces like this in urban settings. It promoted carbon sequestration. It increased nature connectedness, which is shown to be linked to pro-nature conservation behaviors. It allowed for habitat creation and biodiversity. We're hoping to implement a native pollinator garden this spring with hopes to become part of the David Suzuki Butterfly Way project. And it also allowed us to have discussions on making more sustainable choices while participating in our activities of daily living. And this can sometimes be a really polarizing topic. So people would often bring up concerns about how their gardens at home, it was too dry, I can't grow my flowers, or my vegetable garden's not doing as well. And it brought up kind of a passive discussion on climate change and allowed us to have discussions around plant-based meals, considering active and public modes of transportation, composting and recycling, considering water use, resources to manage climate anxiety. And this conversation, I think, can be really well facilitated by occupational therapists because we are experts in prevention and adaptation in the healthcare world. And our skills in the healthcare system will probably be relied on more heavily as our healthcare system begins to change due to climate change. So one last thing and a little bit of homework for everyone here today. I'm also a parks provider. So I'm a registered parks provider, which is an initiative between the BC Parks Foundation and a number of national healthcare partners, driven by healthcare professionals who want to improve their patients' health by connecting them to nature. I'm a parks provider because I believe that nature-based interventions are one of the most low barrier and sustainable interventions we can initiate in our community to promote health. And it helps create a sense of responsibility for community members to protect the environment. So with that, typically people see benefits in their health with 2 hours a week for 20 minutes at a time. And at least 2 hours in nature has been shown to significantly drop cortisol levels within the first 20 to 30 minutes, which is why we have that 20-minute rule. And if you do find yourself out in nature, I encourage you to think of the leave no trace principles while you're out enjoying the environment. At the QE2 Health Science Center, we're very fortunate to be about a 5-minute walk from the Halifax Public Gardens, which is where these pictures were taken, Point Pleasant Park, Shuby Park, and the Halifax waterfront. And these are all natural spaces that we access multiple times per week as a part of regular programming. Interventions while we were out and about included mindful walks, grounding exercises, journaling activities, scavenger hunts, and macro photography. All right, so sorry for the technical issues at the beginning of that, but I encourage you to reach out if anybody has any questions about creating gardening spaces in healthcare facilities.
Thank you so much, Amelia. That was so informative and so wonderful. If you would want, you can maybe post your email in the chat in case people want to have something directly to look at.
Can do.
I think just copy paste it and throw it in the chat probably. Or you can just type it in the chat. And we already have some questions coming in to the panel, but we'll get to these at the end after we let our other panelists speak as well too. So with that, we can give the floor next to Daryl.
Hi, everyone. Good morning for me. Amelia, if you would mind just closing or just saying someone. Oh, here we go. Okay. Hopefully this is coming up okay.
You're good.
Awesome. Right. Thank you so much for the opportunity to share the work that we're doing. We're kind of at the beginning of our journey in many ways, but there's a huge opportunity. Just want to start well, though, by recognizing that Fraser Health, and I'll tell you more about that in a moment, we provide care on the traditional, ancestral, and unceded lands of the Coast Salish and Nklapamx nations and we are home to 32 First Nations within the Fraser Salish region. And we've also integrated into our territorial acknowledgement an environmental acknowledgement that Indigenous peoples have been stewards and caretakers of the lands, waters, ice, and leaders in ecosystem conservation in what is now known as Canada since time immemorial. So I'm just going to start with a little bit of context about our work in planetary health and about what Fraser Health is. Fraser Health is the largest regional health authority in BC, dedicated to improving the health and health outcomes for over 2 million people in 20 diverse communities. We have over 48,000 staff, medical staff, and volunteers that care for our communities, 13 hospitals, as well as many urgent primary care centers, long-term care facilities, public health, and more. In Fraser Health, we are grateful that we've been able to make a commitment to planetary health. And we do this because, as opposed to just climate change, because we recognize the wider disruption to the natural systems, which are so important for our health and well-being and indeed survival on this planet. But of course, there's overlap between the two, but by taking a planetary health perspective, we recognize the ecological crisis that we're facing and the loss of biodiversity and degradation and how this impacts people's health and well-being. We also recognize that reconciliation is not possible without environmental reconciliation and the importance of traditional ecological knowledge as essential to our solutions. We also know that this work is important to our patients. We actually have patient partners that we work with on our planetary health work. And this, although this isn't directly related to the natural environment, it does show that patients are concerned about our carbon footprint and waste, and that 85% feel that we need to be addressing that. So we have a planetary health strategy. This was part of our goal of making one of the outcomes of making an organizational commitment about a year and a half ago. And in that strategy, we include a direct inclusion of the natural environment, committing to developing new spaces and redesigning existing spaces to both protect the natural world and regenerate the natural environment. For us, that was such an exciting opportunity to be able to include that as a direct goal of the health region. And how did we start? We created many working groups for our planetary health strategy, and I'm pleased to say that a natural environment working group was one of them. So we have members from our Indigenous health team, population public health, our facilities, clinicians who are interested, and our health and well-being team. So it brings all of that group together to be able to help move forward the work that we're doing. And on the right there is a research project that was completed by SFU graduate students who were interested in this topic. And it was a chance for us to just kind of start exploring what a vision might be for us around the natural environment. And that included, of course, just recognizing the threat to natural environment loss and our role of environmental stewards, considering all of the estates that we have. And of course, the opportunity to maximize green spaces and promote biodiversity wherever we can. Again, the reconciliation opportunities for education along with that. Food production as an opportunity. The health benefits for workforce, patients, visitors that Amelia referenced are so important. And of course, the adaptation mitigation opportunities. So our next step was that we actually just really needed to know where we were at. As I mentioned, we are a big health region, lots of sites. There's already some great work that's going on, but we just needed to get a sense of where we were at and what some of those opportunities might be. So we actually were able to get a wonderful School of Landscape Architecture graduate student to come and do a summer project with us this past spring, summer. They completed an environmental scan around best practices of natural environment in healthcare. And the most exciting part was they were actually to come and do an on-site review of three of our acute care sites and three long-term care sites, which included a landscape analysis, which I'll give you an example of some of the outcomes of that. Really engaging with our on-site team, which is just a wonderful chance for the student to walk around and engage with our facilities leads about a topic that is just not often a priority given the busy world of facilities. And for us, we're not experts in this. I'm a public health background myself. I recognize the importance of the natural environment, but actually, what you do for all of us, this has been a great opportunity for us to start learning about what those opportunities were, and even just basic concepts. So, for example, the student was looking at our inventory of natural assets, and just for us to learn the different categorization of green infrastructure that's out there: natural assets, engineered assets, and enhanced assets. And the student was able to not only assess the sites that she reviewed and identify our assets, but of course open the door to develop additional assets. So just here's one example of the landscape analysis that we did from our acute care site. Uh, and the student was able to help us identify the percentage that is tree canopy, as well as other surfaces. Identified the pollutants that were removed annually from the tree canopy. So another advocacy tool for us and making sure that we want to keep our trees and add more wherever possible. She provided a list of natural assets. In this case, there was a creek and a forest, as well as our enhanced assets. There were terrace gardens and urban trees that were out there. She did an assessment of both native and invasive species, and also even noted any wildlife that was spotted. So this was a fantastic opportunity. And in this case, it was such a unique site because there was actually a forest there that was not developed because of the slope that it was on. So it was a real unique opportunity. And here are the kind of like the recommendations that would have come from the site analyses that she had done. And you can see here that with the forest being such a key opportunity, that we could develop a forest management plan, and this could be engaging with our community partners. Removal of invasive species. The forest was beautiful, but it was absolutely overrun with many invasive species. And then she also highlighted opportunities to things like building boardwalks or viewing platforms to get people more exposure to nature, including interpretive signage, and proposed opportunities such as from the environmental scan that she did, such as the forest hospital in Scotland, in the UK, in which they were able to work with partners to enhance the forest that they had on site and make that accessible for patients, staff, and visitors. And they did this, of course, with partners. And just going back to the recommendations, there was a lot of construction at this hospital, and I'm sure this is a similar theme across the country. And it was an opportunity there for us to consider temporary green spaces during construction. She also identified various themes, and just here's an example of one of them around plant health. For the locations visited, noted unsatisfactory landscaping, and of course that potentially is limited by budget, but it also might just be the way that the landscaping that is existing, and that related to, of course, to opportunities to improve irrigation, reduce water usage. Invasive species and monoculture that were present in some cases that could just be left to be more natural and not mowed, or pollinating plants planted where there's just grass. And access to green space, of course, was a concern for some long-term care sites. So we're just starting to work on how we can rectify some of that. So in terms of our next steps, huge communication opportunity to just showcase that this is important to us as a health region. We recognize the importance of the natural environment for our health and well-being of not only our communities, but of course our patients, visitors, and staff. We're continuing to develop research and student partnerships, working with the School of Landscape Architecture, who are thrilled with the project and the potential opportunities that it allows us. We want, of course, to implement all of the recommendations that were given. There was a lot of them, and we are excited about that. It was actually even just an opportunity to highlight existing good practices. There were some volunteer gardens, and so that approach, we want to be able to share that. So it was just even just to understand what we're doing well in our health region. Of course, starting to look at funding opportunities. Things like, of course, Trees for Health is have discussions with them, but just hearing Amelia is getting money from their mental health foundation, and even thinking about our own hospital foundations who are becoming and more interested in being able to support planetary health work. Practical things like reviewing our landscaping contracts, that's going to be actually a really critical piece of this. And just basic things like getting a hold of them and understanding what is entailed. That will impact all of the decisions that we make as we start to do projects, because we are going to need to be partners with those landscapers. And of course, increasing our understanding of the role of facilities. As I said, this project was a real opportunity to engage our facility staff and leaders, and we know how busy they are, so we just really need to understand what we're asking from them. And that's it. Thank you so much for the time to share our experience in Fraser Health.
Thank you so much, Gerald. That was such a wonderful presentation. And of course, if anyone has any questions, feel free to put them in the Q&A session of the chat. We got in some notes in the regular chat as well, too. Becky said that she loved that you included invasive species as an important determinant for sustainability of the landscape. So lots to read and lots to reflect on. So thank you. We'll pass the mic now to Michelle, who will be closing off the presentations for today, and then we'll jump into the Q&A session.
Okay. Thank you very much. Okay. Am I on? You see this? Okay. So thank you for the opportunity, and it's my pleasure on behalf of the Forget for a Moment Foundation to present to you our newest program, the Healthcare Planter Program. Oh, okay. So I have to do it this way. So our mission at the foundation is to bring nature inside healthcare and long-term care facilities. Sorry, I just want to, there we go. Oops, sorry, I've lost here. Okay, sorry here, just having a little bit of technical, what happened here? Can you still see the screen?
Yeah, I can see your screen.
Okay, sorry, it's kind of disappeared on me.
Oh,
So,
no.
yeah, so I'm not sure what I did. Okay, let me stop sharing and start over.
Okay.
Okay, sorry, folks. Okay, there we go. Yeah, so, yeah, it's just that. It's just part of the photos on the side. Okay, there we go. So yes, as I said, our mission is to bring nature inside healthcare and long-term care facilities, and so that provide access to the health benefit associated with plants to those who need it the most. So basically bringing Amelia's wellness garden indoor. And we do this by creating green community space with living green walls and healthcare planters now to break. So we do this to break down isolation and improve the physical and mental health of patients, residents, their families, and caregivers alike, and to bring awareness of the healing power and the benefit of bringing nature indoor. And I don't have to sell you on that. So living green walls. To date, we have been able to offer 4 living green walls. The last one was at the Montfort Alain Chrétien Health Hub in Orleans in the Ottawa area here in 2021. A 30 by 10 foot living green walls integrating the design of a beautiful wing completed, and this was completed during the pandemic. And here's a photo of that beautiful wall. Quite the wall, and it's still blooming today. Now, healthcare planter program. Oops, And inspired by our founder, Janine Lafrenière, during the pandemic, we embraced the idea of offering garden planters for indoor use to create these space. So we went to Lee Valley and purchased the first garden planters to offer. And they were very welcome and appreciated, but soon the request came for a mobile adjustable planter. To our surprise, a mobile and adjustable garden planter did not exist. So we decided to pursue the development of such a planter. Between 2021 and 2023, we engaged, this seems to be skipping. As I said, we engage in the development of a healthcare planter to deliver the benefits of nature to those who are not able to go outdoors. And the healthcare planter has been branded the Jasma from the French name. The Jasma healthcare planter was developed with the support and the input of healthcare and horticultural professionals, and through a series of usage tests in long-term care residents to make sure it fulfilled the needs and expectation of healthcare long-term care facilities. And here you have photos of these planters. You can see one is higher than the other one. They all look differently. And they also, we have a capillarity watering system so that there's no spillage of soil, and all the handles, everything has to be secured inside to make sure it's fully usable in these settings. And so the purpose of this healthcare planter serves multiple purposes: enhancing the ambiance of healthcare environments by creating a calming and comforting atmosphere, providing a source of relaxation and stress reduction for patients, residents, and healthcare staff, offering opportunities for gardening and therapeutic horticulture, and engagement, promoting physical activity and social interaction, offering a vibrant garden experience year-round, regardless of the season. And here you have a photo of a lady, and this is one of the recipients that said because it's mobile, they were able to bring the planter right into the room of this lady that couldn't leave her room, and she was able to experience gardening. The wellness garden was in her room. And most of the baby boomers, a lot of the residents there are baby boomers, and most of the baby boomers were into gardening, so you can see the impact there. So let me talk to you about our 2024 projects. Oh, sorry, it's just skipping here. So planter project with the Ontario Desjardins Credit Union. Our project goal was to deliver the first 30 Jasma healthcare planter to 30 healthcare long-term care facilities in Ottawa and in Eastern Ontario. And that was a condition that Desjardins gave us in providing us with funding. So thanks to their funding and various donors and partners, on November the 6th, 2024, we were happy to announce that we had delivered the first 30 Jasma healthcare planters. And here you have a list. If people are in Ottawa, they'll recognize some of these, but they are there. And so here we have a few photos just to share with you about what they look like, the people interacting with them, testimonial, finally a planter design that works perfectly compared to what was out there. It moves easily, it's adjusted easily, and it's easy to maintain, and the capillarity watering system idea works great. I find the planter refreshing and beautiful. Coming from someone with anxiety, it's soothing to see something growing indoor. Anything that grows is a gift. And here you see a photo of staff and resident working together with the healthcare, gardening with the healthcare planter. We are truly grateful for this thoughtful donation of a Jasma healthcare planter, which will bring beauty and therapeutic benefits to our residents for years to come. And here's a lady really enjoying this. And they all look different, and depending on who's involved. But the beauty of it is that you can take the planter, the container, dump it, and replant. And so it can be seasonal, it can be thematic. We do have a support guide that we sent. We asked the Montreal Botanical Garden. They provided 4 types of gardens that you can plant in, but basically it depends on who's involved with the planter, either volunteers or staff, or to decide what goes in it. And you could have the seedlings in, like you see here, that could go outside in the wellness garden later on. And here, so is a group enjoying the planter. And here are other people getting their hands dirty into the planters and gardening. We planted our jasmine last month, and it's thriving. The patients love having it. In the lounge. There has been much interest in looking after the plants, and it brightens up the space. Thank you very much for everything. We are happy to be part of the Healthcare Planter Program. Here's another lady enjoying the planter. Here is a photo of an event. It was a planting event. I got to participate to this, and it was great to see these baby boomer gardeners, sharing their knowledge and getting their hands back into the soil. And here are people again, planting away and enjoying the gardening indoors. Our home requested to receive a healthcare planter for several reasons. In addition to the physical and mental benefits that gardening can provide, we hope that that in providing connection to nature and past life experience through the use of these planters, we will provide a sense of hope, purpose, and belonging to our residents, which is reflected in our mission statements of experiencing hope, purpose, and belonging. And as I said, a lot of the baby boomers were into gardening, so this is just bringing back a lot of memories. You can see the involvement. Here's a group that in front of a beautiful healthcare planter. So what's the next step? In 2025, our project is to deliver 100 Jasma healthcare planter in Ontario and Quebec. The healthcare plant, and also we are in the process of developing a healthcare planter community to establish a community of collaborators to support and engage with healthcare planter recipients, to participate, to facilitate effective integration of the healthcare planter, both fixed and Jasma, because we can provide a fixed one if that's their wish, and to maximize the planter's positive impact on residents, patients, and caregivers alike. And so, as Daryl said, it's about creating a community coming together with like-minded objectives. Foundation's long-term goal, a healthcare planter in every healthcare and long-term care facility in Canada. And so and we've had individuals now asking, could I get one of those for my home or my backyard type of thing? In any way, you can find us online, Forget for a Moment Foundation. You can contact us at info@oubliepourinstant.org, and you can invite you to follow us on the social media. And so thank you to the Canadian Coalition and Green Health Care, which I've agreed to be a collaborator from the beginning. And thank you to those other brands that you see there that helped us to launch our first project in 2024. Thank you for being there and listening. And hopefully our healthcare planter program has inspired you to provide more garden experience, indoor garden experience. Thank you very much.
All right, thank you so much, Michelle. That was such a wonderful presentation as well. Got lots of questions in the chat and got lots of comments as well too. I'm gonna pass the mic over to Miles, who's going to moderate the Q&A session. And just a reminder, if anyone has any questions for any of our 3 speakers, please add them into the Q&A box on the webinar. Thank you. Miles, take it away.
All right, thank you. And thank you so much to our speakers. Thank you for speaking today. And thank you for all the amazing work you are doing. Imagine if every hospital in the country had programs like this. All 3 programs, right? Why not? So we at the coalition, Yusra's going to look some stuff up. I gave her a last minute task just to add a bit of stress to her life. Can you hear me okay, Yusra? Yeah? Okay. Yeah, Canadian healthcare forests. I'm not going to lie, that's an absolute ripoff from NHS forests. I don't know if anyone's looked at what England's been doing for years, the NHS forest. You can look on their website. So they're much further along than us. This is the same idea. We encourage people across the country to do any number of plantings. Obviously, you saw a sample of things today of what's possible. There's all kinds of things possible. And really all you need to do is reach out to us. Sama is waiting by the phones. Well, that's an exaggeration, but you can email Sama. We'll give you her email. And if she can't answer your question, she'll put it on to somebody who can. We have partnerships like the group that you see today across the country so that we, all we need is someone to reach out, a champion at a site to say, hey, we want to do this. How do we do it? And we'll help you with that. So scrolling back to the questions here. Okay. Hello to Finland. That's pretty cool. All right. Yes, you'll have access to the references at the end. Invasive species. Look, I don't know. Guests, put your hand up if you want to speak to invasive species. Otherwise, I can say something there. Does anyone want to talk about invasive species?
I mean, I think for us, identifying invasive species in our landscape analysis was an opportunity to look at and planting native species and which are going to do better or have a connection to local peoples. It was just a win-win. So that's kind of where that came up in our landscape analysis.
So brilliant, Daryl, that you folks worked with a landscape architect. I think it was a student. I don't know if there was a cost to that. There is, like, obviously I'm in Hamilton. There's a program in Guelph. I keep meaning to reach out to them. Would that not be an amazing summer project for landscape architect students to go to a hospital relatively locally and plan this sort of thing out? Because that might be one of the most difficult things. Yes, invasive species in Hamilton. The Norway maple, just like it sounds, is not a native Canadian species. And in the Hamilton escarpment, which we like to call the Hamilton Mountain, that is all Niagara conservation, all those trees along the escarpment. And our escarpment is being taken over by Norway maple. So that is an invasive species. They drop their keys. They're more aggressive than the native species, and then they take over the environment, and so our bugs and birds, et cetera, don't have access to the native species. So that's what that's all about. Let's see. All right, a couple of other things popping in here. Sorry, trying to keep up. If someone wants to hop on, Eugenie, I see you asked a great question. Do you want to hop on and ask that question, or would you like me to carry on here? Eugenie was asking about the way we manage our sites at hospitals. So I'll give her a sec to hop on in case she wants to. Otherwise, I will ask that question, answer rather. So I've been involved with Trees for Hamilton for 12 years. Interrupt me anytime, Eugenie. And we have learned in Hamilton that there are all kinds of barriers. If you're someone like me who thinks 24/7 about planting trees around the city, and you go through our city in Hamilton, and you see all kinds of places to plant, but it costs $4,000 to tear up a piece of sidewalk and put in one tree, for example. And the parks and parkettes, sometimes those surrounding communities see it as a policing issue, and they don't want people doing dirty deeds in the bushes, and so they don't want trees for that. So there's all kinds of barriers. We have found, Trees for Hamilton, and this is how this all started, that our best partners are the healthcare facilities, the hospitals and long-term care. And not all of them are going to partner with you, but they do recognize this is good for human health. To Eugenie's point, yes, hospitals could do a lot better. Sometimes there's not a lot we can do about who the contractors are. I could tell you stories about that, and she's kind of hit on one. If you are at a hospital that has made this a priority, I think that you should be able to ask leadership, can we not do something which is better for the environment in terms of taking care of the grounds. In fact, why even cut the grass? Okay, next. All right, people love the planter. Amelia answering a question here. And sorry, I'm not seeing, there's a bit of a dialogue going on here. Okay, Caitlin, you're welcome to hop on too. For indoor planters, was there any feedback, issues, or concerns from infection control perspective? Great question. I think that is for Michel.
No, not at this time. And as I said, we did go through a series of exercise as we were developing this, but I have to say that and as I said, we've distributed 30 of them at this point, and nobody has brought that up. And so I think you probably notice a lot of them have potted plants type of thing. But now this flexibility with the planter is like is welcome. In fact, I have one retirement home or long-term care facility. They've created a schedule and they take the plant from floor to floor. They have a schedule and people know when the planter is going to be there, and it becomes like, okay, when's the planter arrive? They told me people are asking. So, and no, but we haven't had any feedback. And this is, as I said, when we went to the botanical garden to ask them to submit examples of landscaping for the planters, this was also part of using which plants, okay? And I saw in a question someone's asking who's maintaining the planters. So usually this is under the director of the recreation or therapy director, depending on the staffing they have. But what we are looking at now is building that community, the healthcare planter community, so that we can provide support. And so we're working on implementing what we call the active living planter program, where we will have master gardeners, therapeutic horticulturalists to go in and provide activities or offer activities to homes that have the healthcare planter. So the challenge is a healthcare planter is alive, and so someone needs to look after it. And so sometimes the residents have a garden club, and so they're involved in doing it. Other times they have they have contracted someone to come in and make sure. But we are hoping to build that community of support. In fact, a horticultural society could say, hey, we'll adopt this planter and we'll go in every once in a while and work with the residents. But it could be student program also, a horticultural school that said, hey, we'll adopt this planter. And so this is one of the ideas that we're playing with now.
All right. Thanks so much, Michel. There was a few questions for you in here, and I will jump over to the Q&A for those who put it in the Q&A. I'm still on the chat here.
Okay.
One, I hope it's a quick question. Michel, how much do the planters cost?
Right now, they are manufactured in Montreal, and they are selling for $2,090 plus tax and delivery. So we hope to bring it down, but this is the first productions. And for the foundation, we look for a donation between 2,750 and 3,000. We provide tax. If someone wants a tax receipt, we can do that. And so that we can deliver the planter to a facility. Of course, we are also agreeable to, if someone makes a donation and say, I want the planter to go to this residence, we are also open to that. So right now we are looking at $2,750 and $3,000 to deliver a planter.
Okay. So a couple, I invite people to take a look at the chat. Lots of great info here. Eugenie has put something in here around best practices, management guidelines for invasive species removal. A great point. And I see Becky. Becky, we need to chat sometime. I could not agree anymore with Becky. There's someone in Hamilton who actually managed to make some form of bylaw against planting trees at schools which have pollinators. And so it invites schools to plant invasive species. And one of those schools that was struggling with that was immediately across the street from the hospital that I work at, where we do all kinds of plantings. There are massive old maples and oaks and poplars, and they're right across the street from the schools. And these pollinators travel miles and miles. So it doesn't make a ton of sense from the first point. And the second point is Becky's saying here, from a climate change perspective, absolutely. We need native species for all our all our birds and bees, et cetera, to survive. And that, I think, is more important. All right. So I'm going to try to hop over to the Q&A. All right. Oh, yeah. So here we are, Amelia. How are you navigating allergy and anaphylaxis concerns around pollinators?
I would say from a general risk perspective, working in patient care and working in like a community-based program, we would assess somebody's needs to have considerations made around those factors, or people would come forward and say, I can't participate in this activity. Is there something else that we can modify to offer? But we do a lot of community-based programming outdoors, and this has not come up as something that's been a barrier yet. And maybe it will in the future. I'm no longer working with that program. But if that does come up, and I hear about it, I'll be sure to let you know if you have any further questions about that. But typically we would just look at it from an individual risk perspective and modifying as needed.
All righty. So there's a question from Sarah. Hi, Sarah. What is the homework? Did one of you mention homework? I might have missed that.
That was me.
Okay,
it was
go ahead.
the park prescription, just a recommendation to connect with nature, and the full health benefits come from 2 hours per week, 20 to 30 minutes at a time. I'll put a link in the chat with some of the recommendations to get started on your own if you're interested.
Okay, great. Love that. I think that most of us are familiar with the park prescriptions program. I've done a couple of talks with Melissa about the intersection between planting at facilities and the park prescriptions, and in a lot of ways they dovetail. Park prescriptions from a clinician point of view, clearly much easier, and it's meant to be easy to, pass over a little piece of paper advising people to go to the park, and so many benefits. I think we also have to do the harder work. And from all the people who are prescribing plant prescription, we know people believe this is important. We need to bring the forest to the cities. We should not need to have to travel very far to get to a park, and that's my thought. So yeah, hopefully some of you want to take what I'll call the next step and reach out and plant something at your office or your long-term care, et cetera, et cetera. Michelle, I don't know if you can see the Q&A questions here, but just wonder, do you think you answered all of these?
There's one more, and someone
Yep, go ahead. Yep.
They seem to say a lot of them look alike. And so when one of our partners with Artistic Landscape Garden Center in Ottawa, and what we did is we negotiated with them that they would provide for up to $100 worth of product to the recipients so that they could go to that center. And what the center did is they got one staff person that they briefed on the planter, the whole purpose of the planter, and also some of the parameters. So, and what that staff person did at that point is they identified some of the plants they recommended for the planters. And so, yes, when you look at some of the planters, sometimes they look alike because of this exercise that we did. So they went to the garden center and they were advised by the staff, here's what we are proposing, and then they took it from there. But as I said, now it's up to each recipient, and in terms of deciding what the planter will look like. But the beauty of it is it can be changed. I just got an email from one of the residents that said that for Christmas they put poinsettias in them, and that all the poinsettias that were in the pot were now gone, but the ones in the planter, they're still beautiful, and the residents are enjoying them. So as you can see, it can change.
I'm going to go off the board here and ask Daryl a question. I don't want Daryl to nod off over there. We only have a few minutes left. Daryl, about the landscape architecture program, just kind of curious, and it clearly every town and city in Canada is not necessarily going to have a landscape architecture program right down the road. But just the concept of you reaching out and finding partners that were able to help and stay within your budget, if you want to just chat a little bit about that.
Sure. I mean, our University of British Columbia has a sustainability scholars program. So they actually students from across disciplines apply to do sustainability work with, municipalities and other organizations. Uh, I mean, we really got lucky. We knew that we actually wanted a landscape architecture student, and we just happened to have one apply. And so it was a bit of luck for us, but we were also proactive in developing what we wanted to get done for the baseline. I just got to say, like, it was just such a positive experience. Partly it was a good fit. So again, there was a little bit of luck, but because the student was so passionate about this as a topic and so willing to learn and did so much work for us. But what's exciting is just the connection that we've made afterwards to the chair and the professor at the School of Landscape Architecture who wants to continue this work and is looking at opportunities for directed studies work that students could do to support us. And we're also seeing if we can't get something in the pipeline to actually support like a student jobs from the School of Landscape Architecture in the future.
Awesome. Well, I see, boy, that it always goes by fast. Hour's almost up. People need to go outside and stretch before the next Zoom. But thank you so much for coming. Wonderful presentations, and thank you all for showing up and joining us today.